Indeed, you're watching Good Morning Kenya. This is Health Tuesday. My name is Mark Migwen. We shift gears now and talk about matters to do with the state of dental health care in Kenya. And in studio I'm joined by Dr. David Kahura Mundia, who is the president, Kenya Dentist Association. Welcome to the program.
Asante sana. Thank you.
Yeah, you know, good oral health is paramount to the overall well-being of a person, but also challenges abound, and we are going to delve into that. But from your standpoint, to start off this conversation, how do you see is the state of dental health currently in the country?
Well, thank you. I'll first begin by saying I'm coming from the Dental Association, Kenya Dental Association, to be per se.
Yes.
It's a premier body that represents all dentists in the country. And our work is to champion for the access of oral health care by all persons. And this is to be provided by dental practitioners, that's the dentists, and the other persons that we work with in collaboration to provide this kind of services. Now, what happens in the country over the last 60 years is that we've not had a lot of spotlight on what really goes on in the dental care industry. So the government, as of now, as you speak, it can be argued that it has neglected the good access of oral health care in most parts of the country. And that's why you have dentists being very sparsely distributed. And our work as a professional association is to push for increased access. So we've been speaking to the Ministry of Health, we've been speaking to the Council of Governors, but they are yet to adopt the stance to bring more access to oral health care services. So as we even speak right now, SHA, as you speak, does not cater for that basic package for dental access by most persons in the country. It's only the civil servants who have some limited access towards dental care benefits. So we'd wish to compel the Ministry of Health and the SHA Authority to consider a revision of packages so that Kenyans can access these services. Because dentistry is thought to be a little bit expensive, but it's only expensive because of the neglect that has happened, such that there are very minimal investments in the public healthcare facilities, such that only the private sector seems to be thriving. So if the government was strategic enough and it placed dentists in places of employment and had these facilities well equipped, then you'll have most persons accessing services as they should. So that's where we're headed to, and that's what we're pushing for.
All right. Now, when it comes to statistics, the National Health Survey indicated that over 98%, that is 98.1% of Kenyan adults are grappling with gum disease. What is occasioning this? Well,
gum disease, dental caries, children being affected, adults being affected, the problem is too large, too huge. And the last survey of this burden of disease was done in 2015.
Yes.
That is about 10 years ago. They are planning, the Ministry of Health, through a survey known as the STEP survey, is planning to undertake another study to check and assess the burden of disease and the investments that have happened over that last 10 years. If the investments are minimal, the burden keeps to rise. Now, these issues happen because you don't have many persons knowing well how to take good care of oral health, such that that neglect that happens over 3, 4, 5 years eventually spirals, causes tooth decay and cavitation. And then if the tooth is cavitated and you're not taking good care of your health, the gum in the mouth gets affected. And that's you start having now gum disease. So those are the conditions that need to be managed, because if that doesn't happen, a lot happens down the line. So there is cancers in the mouth, there is a condition that goes spiraling and mixing with other conditions like aspects of pregnancy, aspects of diabetes, which disease conditions are related to the mouth. We even have high blood pressure, being a condition that is related to what is happening in the mouth. So good oral hygiene maintains overall general body well-being, so which is something that must be advocated for.
Yes, I've seen cases where during pregnancy, the expectant mother has dental problems. What is the correlation?
Well, the correlation is simple. You have an expectant mother who probably in the past years has not been taking good care of her teeth. Now, if this was a condition, you end up now having that during pregnancy, you have increased states of high blood pressure. And because you have a bad tooth and there is a cavity in that area, the tooth starts to sense that there is an exposure to the environment on the mouth. And now the mother senses pain. And that's the time now you start saying, these cavities only happen when I'm expectant. What is really happening? So, but as dental practitioners, we advise that during the first 3 months of your expectancy, attend the antenatal clinics.
Yes.
And you're supposed to be screened in that first 3 months so that if, in case you have any other conditions, the conditions get treated early, rather than waiting until the last trimester. So it's not advisable to wait to suffer until the last trimester because you have a dental cavity or you have a dental issue.
Yeah.
Attend to see the dentist early so that you can have a successful, pain-free and peaceful pregnancy period.
When
So
it
that's
comes,
what we advise for.
yes, when it comes to dental fluorosis and dental caries, it seems quite a good percentage of adult children are affected.
Yes.
Because we are talking at 41% of children when it comes to dental fluorosis. And also dental caries carry around 41.4% of children. Why is it affecting children so much?
Now, in Kenya, luckily, geographically, we are situated in the Rift Valley region, whereby during volcanic formations of the rocks around this East African region, our rocks are formed naturally with a concentration of high fluoride content. So most of the water that comes from the water table has a lot of chemical components, which are now known as fluoride.
Yes.
Now this fluoride leaches into natural water, domestic water, and if it's not well filtered, it's consumed as raw as it is.
Yeah.
It can be argued it's not of the best quality. And because most areas in Kenya don't have water, most persons have drilled boreholes. Now this water is consumed as it is. And anyone who uses this kind of water gets affected. That's why you find Nakuru, Naivasha, Ongatarongai, Kisumu, Mombasa, almost most parts of the country, they are affected by the type of water quality they're using. So we'd want to push the county governments, the ones in charge of the water resources, to consider having filtration centers to purify water, not just exactly to purify, to lower the fluoride levels in that water.
Yeah.
Because those children, once they are young, they're exposed to that kind of water, they are affected by a lot. Their teeth start to discolor, they become too hardened, they become brittle, and the teeth start to break down. And eventually this now spirals out to bad oral health care, and you go that way into adulthood. So all these things are avoidable by prevention, making sure that persons access safe water quality. All these apartments in most of these towns, they don't have water standards that are supposed to be well regulated. You have the NEMA, not a NEMA authority, the water regulatory authorities, and you have the environmental agencies who are supposed to, by right now, they have already even gazetted the minimum threshold of amount of fluoride that should be in that domestic water. But you find that the public health officers are not doing their jobs to inspect when they're giving the certificates of occupation to these buildings to allow safe water to be used by the residents. So any type of water is sold out there. And that type of water is exposing a lot of persons to the fluorosis menace, which is something that is regulatable and avoidable. So you don't have to incubate a problem by just exposing people to bad water and bad oral health.
So there's a gap in terms of enforcing this regulation?
Enforcement is not happening. All buildings are getting certificates of occupation. Yes, the drainage is okay, but the water to be used in that apartment is not of the standard that is acceptable. So if that is not the case, the owners of the buildings must consider to install reverse osmosis systems or other systems that purify the water so that residents can use quality water that does not jeopardize their dental care.
Yes. From your assessment, if you're looking at access to dental health care, how would you say, how do you rate the access to dental health care in the country right now?
Well, for now, we'd say the access is very limited, very limited. A few levels 4 facilities, level 5s and level 6s are providing access to dental care. That is the public facilities. And then in the major towns, you are having the private practitioners who are situated there to provide dental care. So the blend of these two areas, the public and private, is still very minimal because even as we're speaking, you have about 2,000 at most dentists in the country. And they are only distributed mostly in the urban centers. This is because in the last 10 years, again, the government, since devolution and after that 5 years, 2015, they have failed to or employed very few dentists in the public sector. where most of the Kenyans go to seek services. Most Kenyans actually visit that public facility near them. And if they don't have a functioning dental facility, they have no dentist, then these persons will probably just go to the private sector, which is a little bit more expensive. So it will be much better if the government, the national, had the Directorate of Dental Care Services. Because for now, as we're speaking, we do not have a Directorate of Dental Care Services. Dentistry falls under medical services. And as such, it becomes neglected. For many years, it's neglected because it gets very minimal budget, very minimal attention, and the county governments take suit of the same kind of operations, and they also do not advocate for access by majority of Kenyans. So if we change the mindset, created a Directorate of Dental Care Services, you'll have more visibility, more installations of infrastructure, more persons getting employed, and more Kenyans accessing these services that are much needed. And we will not keep on struggling with the access to dental care services.
What about the cost?
Now, cost again in public facilities is well subsidized because the government pays the doctors. The government has a way of bringing resources towards access to dental care services, and the services are well priced for them to access. But if you limit access in the public sector, and the only access that is available is the private sector, and persons in the private sector have to import, have to buy everything at very high costs, have to meet all these overheads, then the cost of dental care becomes very expensive. So a balance needs to be done so that costs can become fairly distributed by the government providing its own infrastructure of access to dental care services. That is where we are kind of failing for now.
Okay.
Yes.
In terms of dentist to population ratio, what are we looking at, especially in the country, comparing to the standards of World Health Organization?
Well, the WHO says that we should have at least one dentist per 7,000 persons. Right now we are speaking of a number of about one dentist per 60,000 Kenyans. So that's very low. And that means access is very, very limited. So we have persons who work with us, who help us down at the community level, who are supposed to talk about oral healthcare promotion and prevention. That is to reduce the amount of disease burden, because you cannot have many dentists as much as the population is in that number to meet the need. So sometimes you speak more about prevention to lower the cases, and then the ones who are already affected, they need to go through the curative route and get treated. So we have community oral health care practitioners who are supposed to be out at the community levels speaking about what is good oral health care. What do you need to do to avoid dental disease, dental caries, cancers of the mouth? What are you supposed to do to avoid all this?
But is there enough penetration of such initiatives?
Yes. Now, in the 1990s, the government had a plan. The way we have a CHP program right now, the CHPs are employed. They are working at the community levels. They're supposed to network with the primary healthcare networks and provide caseloads of patients towards the bigger facilities. The same principle was supposed to be used for the community oral healthcare workers to go and bring these dental care cases from the community levels up the hospitals. But the government dropped the ball. These persons have not been employed for so many years, and these persons have remained out there without doing that job of filtering or minimizing the cases that are coming up. So prevention is very important. And these persons, the community oral health care officers, should be considered by the government to assist the dentist to provide access to oral health care in a seamless and efficient way. So that should be the path of referral. Yeah.
The Kenya Health Facility Census of 2023 indicated that there are only 13% of facilities that provide oral health services in Kenya. This means that there are gaps within that aspect. But how can they be addressed and raise the number or the percentage of the number of facilities that people can use to get dental health?
Okay. About facilities, I would say for now, as per the surveys by the regulator, we have enough. There's a ratio you can use the facilities with the population. Check the density of distribution. It has been argued, I could confirm again, that we argue that we have enough medical facilities providing access to care. Now, the quality of care now could be the challenge. Who are these persons in these facilities? Are these facilities manned by dental practitioners or by any other persons who are not doctors? Now, the argument should be, in my view, from the professional point of view, each of these facilities, most as they are, if they do not have a dental practitioner, that is not right. Because now you have other persons who come into the market because they know there's a bigger need. They come in as masqueraders, as quacks. So we have fake dentists or fake persons who claim to be dentists to be providing services. That is causing more harm to Kenyans, and the regulator should move by ensuring that all these facilities, as many as they are, each of them is superintended by a dentist or a dental practitioner who is working with other staff complements to support the access to dental care services. So you have a dental nurse, you have a dental assistant, you have a community oral health care officer, you have a dentist, and you have a dental specialist. Now, a dental specialist is the one on the higher rank of the hierarchy, who in that panel, they provide access to as many specialized services as Kenyans should access. So each of these facilities, level 4s, level 5s, and level 6s, should have all these kind of staff complements to provide access to Kenyans. So the issue of facilities, in my view, it is quite, they may be enough, but the staffing of those facilities is a problem, and Kenyans are suffering by a lot.
As Kenya Dentist Association, have you had cases where you deal with the fake dentists?
Yes.
How have you handled that?
The cases are quite plenty. We are collecting data. On our website, there's a portal whereby Kenyans can go and post complaints of whatever has happened. And if this has happened, they're supposed again to use these complaints, or ourselves as the Kenya Dental Association, forward them to the regulator, which we have been doing. But the regulator, again, we probably have not seen them come out and smoke out these persons. Because if you go to Isili, today as we speak, facts on record, most of the streets in Isili do not have dentists. But most of the streets in Isili have places marked dental clinic, dental center, dental that. Most of those places, on record I would want to state, they are not dentists. And the regulator is failing on the job by exposing Kenyans to such harm. And it's not just Isili. Most of the urban centers, there are those small outlets that are saying they provide dental care services. So there's a dentist, there's a dental specialist, and then they support staff. So some of our support staff are the ones who mutate out and come out and say, we are dentists as well.
You said there's a dentist and a dental specialist. What's the difference?
Now, the difference between a dentist and a dental specialist is that a dentist has learned the general dentistry. Now, the specialist now is someone who's gone back to school, has done a 3 to 5 years master's program on the different fields of dentistry, because dentistry is so wide. It's only that you only think it's about just the tooth, but it's not about the tooth. There is a dentist for children. They're called a pediatric dentist. So they're specialized in their master's program to just deal with children matters. There's a dentist who deals with only old people. They're called geriatric dentists. There's a dentist who deals with gum disease, just an expert of gum disease. Everything gum, they're the experts. It's another 4 or 5 years master's program. There's a dentist specialty that is caused with the issues of teeth alignment. So you have all these people with the teeth that are crooked, teeth that need to be placed in a straight fashion. They're called orthodontists. Another 3 to 5 years master's program. So like now if you move through Nairobi, you will see most people have braces. All these braces, fact on record, they have not been done by orthodontists. They have been done by any person who just go, they buy these things, stick them in people's mouth. They are not trained on how to do it, and they do not even follow up on cases. So most Kenyans are exposed to harm that is not regulated, and outcomes that should not happen because the market is on free fall. No one is doing the right thing. We also have other specialists like a prosthodontist. This is a dentist who works with teeth replacement. If you happen to miss a tooth or something, probably you're elderly, you've lost all the teeth, they fabricate teeth in your mouth, new sets, so that you can continue functioning and you can enjoy having a good quality of life. There's also another dentist who works with oral cancers, surgeries, tumors, anything on the face, cosmetic work. They're called maxillofacial surgeons. So I'm in that field of maxillofacial surgery, where I did my general degree in basic general dentistry, and went further to do now the surgical aspects of dentistry. There's another dentistry type of practice which is known as cosmetic dentistry. These are people now who are into looks. Do you want your teeth whitened? Do you want your teeth with glitters? What exactly do you want? So they're trained again in that particular field. So all these fields of training take about 7 to even 10 years of mastery. And that is the standard of dentistry that we should be practicing in Kenya.
So for a person who has teeth problems and they go to a place, they see a sign dentist, and they think this one will sort my problems, but they do not know if they are qualified or not. How would you tell one is a qualified dentist?
Thank you.
Yes.
Now, the way it goes, if I put on a white coat, even you, if you put a white coat today and you say you're a doctor so-and-so, you probably would pass. But they have devised a system, like an SMS system, a USSD code, or they can ask you your name and search on the portal, on the Kenya Medical Practitioner Dentists Register, and search these persons. So if they find that this person is not registered, they're supposed to make a complaint. But some of the times you'll find that these quacks will probably go by someone else's name, or probably just print a fake ID and misrepresent themselves that they're claiming to be the other person. But they're not trained on the job. All they want is your money because you're willing to pay. And they'll offer you a very low price to attract you, and that becomes a game of sustainability. So all ourselves as Kenyans, what we should do is to always ask, are you qualified? Check, give me your ID, check on the register, or probably verify among the networks of your colleagues as patients, or even with other doctors. Again, as a professional society, we are moving forward again to have another double kind of registration check so that Kenyans can verify who is a real dentist. Because that game is not tried the way it is happening around here.
Yes. Now, when it comes to dental health in Kenya, and now we have the rollout of the universal health care, how do you see it likely addressing matters to do with the dental health care?
Wow. SHA was launched in 2024, 1st of October. And when it was getting launched as a professional society, we did protest that UHC was moving without the mouth. And world over, even last year, the WHO spoke categorically that we cannot have UHC with the mouth being an absentee of that scheme. The mouth is part of the body, and there's no way the mouth can exist outside the body. So all universal healthcare coverage programs must consider services of the mouth. And that's why speaking today as SHA has not created a package of dental care services. And you'd want to compel, possibly, as a new CEO comes in on board or SHA, to consider formulating that benefits and tariffs advisory panel to provide access and coverage of dental care services by Kenyans, at least to some extent, because persons are greatly affected and they're all contributing towards this particular fund. So you cannot just contribute to the fund to benefit medically, body-wise, but the mouth is not benefiting. So that's not UHC. That's another kind of thing which should not be the case. So the movement is no UHC without oral health care. And that's not my statement. That's a statement by the WHO. Yes.
So as Kenya Dentist Association, how would you want it incorporated in a way that you feel now this addresses matters to do with dental health care? Well,
we have about 13 million households in the country, they say, from the last surveys they've done when they were setting out from NHIF to SHIF. And a package that caters for at least 4 persons in the household should be designed.
Yes.
Well, they have experienced persons who, through their economic interests, they can allocate through the risk modeling again, how much each of these households should get. So it can be maybe 20,000, 30,000 per household as a limit, as per package. The way they've said renal is 750,000, or cancer is 500,000, or ICU is 28,000. The same way risks can be modeled, and each household gets an allocation towards their benefit.
Yes.
And that can be consumed in that 1 year. And then the access can be from either level 3s all the way to level 6s for all Kenyans to enjoy parts of their contribution. So these levies should not just disappear with the mouth not being taken care of. And like I said, the mouth has a relationship with cardiovascular diseases, diabetes, and many other conditions. And all these conditions have better outcomes when the mouth is well taken care of. So if the mouth is not well taken care of, your diabetes will go bad. Your cardiovascular conditions will go bad. Other conditions also go bad. So the mouth is a very important component of that body.
Now, you spoke about something to do with preventive and curative dental care models. But how do we incorporate the preventive care model more than the curative one? How could that work out?
Okay. Well, the way the country has its systems of levels 1 to level 6 is kind of referral. At levels 1, 2, 3, those are the primary care centers. And with our community oral health care officers functioning at those points, they're able to filter, go to the communities and educate. It's all about education.
Yes.
So we have young mothers. You have women attending the mother and child clinics. But there's no one to speak about oral health care. Most for someone who's at least bit more competent about these things. We have school programs. Children should be spoken to about these oral health care conditions early, so that the prevention and the discipline of taking good care of your mouth starts early. So if these programs were kept to be undertaken by the Ministry of Health or the different county governments, you have more cases of prevention, because dentistry is all about preventing. If you minimize the amount of sugars that you're taking, you brush your teeth regularly at least 2 times in the morning, and at least once a year do a checkup, then you'll probably be very safe and not be exposed to dental care conditions. But then there's other aspect of cancers now, cancers of the mouth. These are issues that are coming about from habits. Like areas in Embu, Meru, persons around that region, they're taking a lot of Mira,
Yes.
Mogoka, and the pesticides that they're using to spray these crops, they can be educated about it so that they don't get affected by these chemicals. Because as much as they're getting affected, we're having rising cases of oral cancer. Smoking again, alcohol. These are things that are associated with oral cancers. So if we did a lot of prevention and education of the masses, persons will understand what causes dental care diseases or oral health care conditions, and they'll become low. And whenever they happen, there's that referral network. Do a referral note, refer them to the next level facility, where they'll meet a dentist or a dental specialist, and their services will be addressed or matters as they are. Yes.
Now, as we come to a close, in terms at policy level, what needs to change in order to ensure that there is equitable access to dental health care in both urban and rural settings?
Okay. Firstly, I'd want to speak about the regulatory aspects. For a long time, dentistry has not been well regulated, in my view, and in the view of the professional society that I'm representing. And we feel that it's time we had a pure regulatory body of dentists and other support staff that were working in that field. So that things are well ordered in a way that they're able to do that access and that promotion of oral health care services. So if that was done, then it'd be much easier. Because for a long time, it's been like only medics, the medical doctors, have a bigger scope and what they do, such that the dentists have become like forgotten practitioners. So regulatory practices, we need to consider a change. So the dentists and the allied support staff can all be regulated in a one way, which promotes more access and more training of this particular kind of persons. The other things that have happened is the ministry, the organization of the ministry, such that dentistry comes out as a pure directorate, so that services can be promoted much better, budgets can be well done, and more services can be put out there from the national to the county governments for Kenyans to access. Because as we're speaking right now, dentistry falls under medical services. Somewhere in there, we have pharmacy as a directorate, we have nursing services as a directorate, and these ones are kind of doing well. But for dentistry to be hidden down there, it needs to come out and run at par because of the years of neglect that has happened. So those are some of the things that we need to consider. The other things to do is to increase or improve the infrastructure of training. We only have 2 universities, Moi University and University of Nairobi, training dentists in the country. So if these universities were well supported, their infrastructures get updated, we'll have more dentists coming out and more access to quality dental care services. We have KU, we have Maseno, we have Mount Kenya University, we have Strathmore University. All these universities can be supported by the government or through PPP programs for them to come up and design dentistry programs. That is the Bachelor of Dental Surgery. And you have more persons coming out, well qualified, to offer the best care that is that Kenya should access.
Thank you so much, Daktari, for coming to talk about the state of dental health in Kenya.
Karibu sana.
That is Dr. David Kahura Mundia, who is the president of Kenya Dentist Association, speaking to us on matters to do with dental health. This is where that conversation ends. But